Okay, good afternoon, everyone. Welcome to today's health talk, and today's topic will be about diabetes education guide to manage diabetes. Today we have Muni and Alicia from our SGH community nursing will be sharing this topic with you. So if you have any questions along the way, do type in the group chat, and you, at the end of the session, we also have a Q&A session where you can actually share all your questions with us, and then we can answer one by one accordingly. Passing over the time to you, Moni and Alicia.
Hi, good afternoon. Okay, give me for a while. I'm going to share screen first. So today we're going to talk about guide to manage diabetes. Okay, we have our nurse Alicia C here to answer and also to teach according to the needs of what all of you all wish to hear. Feel free to ask a question and also feel free to get yourself ready to answer the questions. Okay, have a good time. Sister, why is my mom like that?
Sorry to keep you all waiting. I think there's some technical issues on our nurse's laptop. So please do give them a short while for them to fix the situation.
Okay. Yeah.
Ooh.
Just now all fine. I want to start and okay, can everyone hear me?
Yes, we can, Alicia.
Can. Cannot hear me. No, can I just use my laptop? No, my one cannot hear. I test this morning, okay. Yeah, that's why this one also we try so here.
Alicia, we're able to hear you.
Recording in progress.
I use your one, is it? Okay, sorry for that.
There's some echo. Is it possible to turn it off, or maybe somebody is using two?
Yes, thank you for the feedback, Miss Julie. I think there's some technical issues on the back end. Do give them a couple more minutes to settle the situation. Thank you all for being so patient with us. Did not anyone still remember what was being shared during our last session? On our first series on the diabetes talk. I hear a long silence. Alicia Mooney, your side, is it okay?
Hi, Felicia. We are not able to share screen.
Oh, okay. Just I think. Oh, are you using Mooney laptop?
Yes, then we
Okay,
have.
sorry. Yeah, do you mind giving the co-host right to Mooney so that she will be able to share screen? Thank you. Ping, are you around?
Okay, I think we will just do two.
I think there's a bit of echo as well. I think we need some one laptop to actually mute the volume. Otherwise, the end will have some echo like what our participants had shared earlier on. Precious.
Okay, hi everyone. Yeah, thank you for your patience. Okay, so today we'll be bringing to you the topic on Guide to Management of Diabetes. So here's the content. We'll be going through how can diabetes be managed and controlled by diet and medication. Some of the dietary guidelines, tips on diabetes management and medication management. What to do in case of hypoglycemia and hyperglycemia. Some eye care and food care screening guidelines, food care tips, as well as basic principles of exercise for diabetes. So moving on, we would like to ask the audience this question. Is it true or false? Can diabetes be cured? Answer is no, diabetes can't be cured. It is a lifelong disease, and however, diabetes can be controlled through a combination of treatment in terms of management of diet and medication. So it is important to balance your diet using the healthy plate concept. You should eat a variety of food to meet your nutritional requirements. Your dietitian can work with you to ensure that you eat a suitable amount and types of food from each of the food groups. In addition, it is important to have regular meals at the same timing every day. This provides a regular and constant amount of sugar from the food you eat to reduce fluctuations in your blood sugar level. For those on medications and or insulin therapy, eating at the same timing every day also allows the action of the medication or insulin to match your food intake, hence preventing low blood sugar. So what kind of carbohydrates should we go for? We should choose carbohydrates that allow us to raise our blood glucose slowly. We need carbohydrates in our diet for energy, but some carbohydrates are better than others when it comes to managing diabetes. So we should choose carbohydrates such as brown rice, oats, wheat bread, and whole wheat flour. Basmati, couscous, white bread, white rice, fine wheat flour should be avoided.
Are you talking? I can't hear you.
Hello, can you hear us now?
Yeah, now can.
Okay. So it is recommended to have 2 servings of fruits per day to provide you with adequate vitamins, minerals, antioxidant, and fiber. However, fruit can also contain carbohydrates in the form of sugar, and it can also help to increase the blood sugar level if you consume too many fruits. So it is important to have 2 servings of fruit per day, have 1 serving of fruit as a snack, but to spread them out throughout the day. So do not eat all the fruits at one timing. Eat fruit with your meal, and then to choose fresh fruits over fruit juice. So what is 1 serving of fruit? Okay, the following pictures are examples of 1 serving of fruit. You can have 1 small apple, pear, or orange, a medium banana. When you eat your grapes, you need to count about 10 grapes. It's considered 1 serving, as well as 1 slice of papaya or watermelon.
Sorry, Alicia, I think you're muted.
Sorry. And then we will order sugar drinks. So exactly how many teaspoons of sugar are there in this drink? So for a drink like the chocolate malt drink, there's actually 4 teaspoons of sugar. So we can actually ask for kosong, which is no added sugar. Then there's the fruit juice. So we can consider to eat fresh fruits instead of drinking fruit juice, which are very high in sugar content. For teh and kopi, we can ask for siu dai, which is less sugar and evaporated milk. Bubble tea is considered to be very high in sugar content. So if you really want to have a bubble tea, consider to opt for 25% or 0% sugar when ordering. And then you have the soft drinks, which are very high in sugar content. So you can also try to look for the healthier choice in both. So the next slide says discussion, true or false. People with diabetes must not eat any, diabetes type 2 must not eat any sweets or chocolates at all. Can we have some answers? People with diabetes type 2 must not eat any sweets.
False. You can eat a bit.
Can eat a bit. Yes, you can eat a bit, but those with poor blood sugar level should try to avoid eating too much of it, because they can increase the blood sugar level and unwanted sugar level spikes very fast. In addition, these chocolates and sweets have very little nutritional value. So if you really want to eat it, for people with type 2 diabetes, take small amount, and you should also consider to do a blood sugar test before and after eating. So moving on, we have the healthier food choices. So here are some of the guidelines for taking our food. Instead of deep fried dishes such as fried wonton, you can opt for dishes such as same thing, the wonton, but then steam or stir fry it will be a better option. Instead of dry version of fishball noodles, you try the soup version. And then instead of syrupy dessert like ice kacang, you can opt for a more healthy version. So instead of curry and sauces such as curry, mee siam, and laksa hor fun, you can opt for dishes without gravy such as sliced fish bee hoon. So moving on to healthier snacks. Okay, so for this one, these are just some examples of healthier snacks. For more comprehensive diet counseling, it will still be better to see a dietitian. But for now, here are some of the healthier snack choices. For example, nuts. Nuts have good cholesterol, which can help to reduce cholesterol level. So go for nuts that are unsalted, unsweetened, or black and roasted nuts. So moving on to fresh fruits. Fresh fruits, as we said earlier, are high in fiber and can help to keep you full longer. It will be good to choose fruits that are less sweet, such as pears and apples. So one fruit is equivalent to about 70 calories. Wholemeal crackers is also a good option for healthier snacks. So wholemeal crackers has more fiber in it, and compared to plain crackers and soda crackers, it has more fiber, so it can keep you full for a longer period of time. Eggs. Eggs are high in protein and does not affect the sugar level. For healthier cooking options, choose to boil your eggs instead of eating them as deep fried. So last but not least, we have low-fat plain yogurt, which is considered to be high in probiotics, nutrients, and can also help in digestion. So if you really crave something sweet, you can have some low-fat plain yogurt with slices of strawberries or fruits in it to jazz up your yogurt. So next slide here, we talk about how we can cook healthy and yummy meals. So as previously mentioned, you can choose to stir fry your food instead of deep fry, boil or steam your food, grill or bake it, which tastes equally good. And then we also need to be more aware of reducing the salt level in our food. Choose healthier cooking oil. So this how we can choose the healthier cooking oil is when we buy food products, we look at the healthier food symbol. And then when we eat meat and poultry, etc., we try to remove all the visible fat. For example, chicken skin and all, can try to remove it before you cook your food. So what about during festivals and celebrations? Okay, so these are some of the tips that we have come up for you and that can help you to plan your meals. So you can plan your meals ahead and then opt for healthier products. Same thing, cook using healthier cooking methods. Always remember to eat in moderation. So example like Chinese New Year, Hari Raya, etc. One day you can have many visiting and events. So each visit, you try to limit the amount of food you eat in order to be able to go to every place and enjoy some food, but you have to eat in moderation. And then we should also try to avoid alcohol as much as possible, because alcohol, if taken, right, it can actually increase the blood sugar level. So when you take a standard alcoholic drink, it actually contains about 10 grams of alcohol and a lot of sugar in it. So try to opt for alternative beverages such as sugar-free soda or water to mix your drinks instead. And then next question. So where can I obtain more dietary information for myself? So you can obtain more information if you are keen from the dietitian. So it'll be more of a tailored approach to help you understand what is good for you to eat, and then help you to evaluate your current eating habits, as well as to assess what are the specific dietary needs that can help you to improve your eating habits, and also come up with an individualized nutrition plan just for you. So, question, can I consume diabetic products? For people with diabetes, do you think that you should just limit your food choices to diabetic products? Yeah, we have some. Yeah, answer false. Very good. So why should we not limit it to diabetic products? Is because studies have shown that diabetic products such as diabetic chocolates and biscuits are often unsweetened with artificial sweeteners, which actually can have a laxative effect if consumed in large amounts. Then also some of the diabetic products are actually very high in fat and not suitable for overweight people with diabetes. So instead of helping you to control your sugar level, the fat content in these diabetic products can also increase your weight in the long term. So remember that all these diabetic food products still have carbohydrates, and then may not have the good nutritional value in it. So moving on to treating diabetics, things to note is about medication and insulin. It is important for us to take our medication regularly at the correct time as prescribed by your doctor. So example, if you are to eat a medicine at 9 a.m. every morning before your food, you should keep to the timing in order to ensure a regular blood sugar level. And then also to eat regular meals to prevent low blood glucose. So throughout the day, you should portion your food into small amount, eat in moderation, and then have regular meals to prevent blood sugar spike. That can happen if you eat a huge meal at one time of the day and choose not to eat for the rest of the day. So also for people who are on insulin, it's very important that you check the expiry date on your medication and then to discard it if needed. And then last but not least, if you are ill or feel unwell, you should always consult the doctor. Okay, next activity, we have a question to ask you. So, true or false? Tablets or pills for diabetes are a form of insulin. Are tablets or pills considered a form of insulin? Anybody knows the answer for this?
I don't think so.
Yes, correct. Tablets and pills does not equate to insulin. Okay, so let us teach you a bit further about the kind of medications for diabetes. Okay, so there are different types of medication that might be prescribed for patients with diabetes, and then different medication actually have different actions and then work in different ways, again on different parts of the body. So remember this important thing, different medication, different actions, and then they work in different ways on different parts of the body. So you can always check with your doctor and get more information, but the most important take-home message that we want to bring across to you today is that you have to take your medication as prescribed at regular timing. So some of the guidelines that we have for you is, if you miss a dose of the medication, take it as soon as you remember. So if it's near the time for the next dose, you may wish to skip the current dose. So let's say you forget to take your medication at 9 o'clock. Then you realize it only at 11 o'clock. Okay, and then it is near your lunchtime. And then if you have medication for lunchtime, you should take the one closest to your lunchtime. You may skip the missed dose, but then after that, the next day, remember to take it at the same time again before breakfast so that you can eat it at lunch. So if today 9 o'clock you miss and then you remember only at 10 or 11, you don't go back and take double dose, okay? You eat for the next one that is closest to your meal time. So if you are important tips as well, if you are taking certain diabetes medication and let's say you are going for some procedures such as some scans, medicine like diabetes medicine like metformin should be stopped at least 2 days before your scan. So such things are also important for you to inform the doctors so that they are aware. And last but not least, we want to emphasize on the importance to not take alcohol when you are taking diabetes medication. Okay, so moving on, we have this question. Do people with diabetes who take insulin actually can recover from diabetes? Meaning, does insulin actually cure diabetes?
Excuse me, what is
No,
insulin?
No.
Insulin is a form of medication that usually is taken via injection into the body. Yeah, so its purpose is to help to regulate the blood sugar level. So usually people with diabetes, they have insulin injection before they eat their food, and then this will help to regulate the blood sugar level to prevent very high spikes. So this is because usually diabetes patient, right, there's two kinds, that's type 1 and then type 2. So they have trouble. Type 1 is they cannot produce insulin, which is from the pancreas. So this purpose is to help to regulate blood sugar level. Type 2 is that the pancreas overwork and then cannot produce enough insulin to help with the body regulation. So this man-made form of insulin or medicine, when we inject into our body, is to help to regulate the blood sugar level. Yeah. So question is, do people with diabetes, right, once you inject this medicine, do you think it can cure you? That means no longer have diabetes?
No. False.
False.
So raise the hand.
Yeah.
Hi, Josephine.
No
Is there any
cure.
questions?
Yes, it's not true.
Very good. Yes, it's not true. So remember, diabetes cannot be cured, but then the blood
It
sugar
only
level,
can prevent only.
correct, it can help to regulate. So to prevent either too high or too low the blood sugar level. Okay, so all people with diabetes, next question. Do all people with diabetes need to take insulin?
No,
Okay.
no,
No.
Anybody else have answer for this?
no,
No.
not all.
Correct.
No.
Okay, so
Yes.
as just now we actually covered a bit about it. People with type 1 diabetes, right? Okay, so their pancreas totally stop producing insulin. So insulin is actually a hormone that helps to regulate the glucose from the food that we take in. So whereas compared to type 1, people with type 2 diabetes actually start with insulin resistance. So it means that your pancreas is actually working fine. Then over time, maybe it overworks and then it breaks down, then you no longer produce enough insulin. So all in all, right, people with type 1 diabetes actually need to take insulin, while only certain people with type 2 diabetes will need to take insulin to help control. So remember, type 1 needs to take because they don't produce at all. People with type 2, they have to see the doctor, get reviewed, and then the doctor will prescribe the dose of insulin according to their, usually their sugar level and all, then they will give the prescribed amount. Okay, to regulate the level. So a little bit of knowledge for you. This is how insulin therapy actually works. So we break it down into very simple photo. Imagine the insulin is like a key, okay? And then the sugar is the cubes that you see there. So insulin allows sugar, glucose into the body cell. So this picture demonstrates how insulin therapy works in the body. When you inject insulin into your body, it allows the sugar or glucose to enter your body cells, and then it will help to improve the blood sugar control and prevent or delay complications that can be caused by diabetes. So later we will cover a bit more about what are these complications and how to prevent them. Okay, so insulin injection in the long term can actually have some side effects that are not so good for us, such as hypoglycemia, which is low blood sugar. So let's say if you inject insulin into your body and then you get caught to go somewhere or you get distracted, and then after injection, within 30 minutes to an hour, you don't eat your meal, your blood sugar level will actually drop to very low levels that could actually cause danger to your own life. So side effect is like you get very drowsy, you feel like the world is like dizzy, and you feel like you cannot really wake up. So drowsiness and all these are signs of low blood sugar. So always remember, once you have insulin injection, you need to eat within the period of time. So another potential problem is that insulin is actually can cause potential weight gain, in the long term. So true or false? People that take insulin have serious diabetes than those on oral medication.
True.
False.
True.
So people that take insulin have more serious diabetes than those on oral medication. Not likely. There is always such thing as underlying diseases. Okay, it all comes to accumulation of all the other chronic diseases. For example, if you have diabetes with underlying hypertension, or even if you have
Diabetes.
high cholesterol, it does have it cases differently. So not all people who have insulin have serious diabetes compared to those who only taking oral. It's all
Sorry,
pertaining to
Alicia,
the
I cannot hear you
background of-
because this question, can you repeat again the answer?
Okay, so it is false because it doesn't. Not all people who have diabetes and taking insulin have serious diabetes, because there is such a thing whereby it depends all individualized. Some residents who have diabetes have also underlying diseases such as hypertension, hyperlipidemia. So it doesn't really conclude that you have serious diabetes. Yeah, so we do not take it as all people with insulin have serious diabetes than those on oral medications. Yeah. So in fact, oral medications also come in different doses and different amount. Yeah. So technically, we do not sum it up as, "Hi, I'm taking insulin. My diabetes is more serious than yours." There's no such thing. So we take it as false. Yeah.
Okay. Okay, so moving on, we would like to look into monitoring, how to monitor your condition if you have diabetes. So the few things that we want to look into is the blood glucose level. So and then what is the blood glucose level? How is blood glucose actually tested? And then we have this HbA1c. What is it and how is it tested? What's the difference basically between blood glucose testing and HbA1c testing? So how to manage hypoglycemia? So some of the signs and symptoms of hypoglycemia that we mentioned earlier are changes in behavior such as moodiness or confusion. So let's say you talk to someone and then the person answer you something that is irrelevant, like what day is today, then they answer you what time. So they are confused. Or like if they are unconscious, that means when you try to talk to them, they cannot wake up. Okay, they lose consciousness. Or if they are very hungry, tired, then when they have symptoms like trembling hands, their hands start to shake, and then they start to have sweat, and then dizziness. So these are all signs and symptoms of hypoglycemia. So hypoglycemia, as you can see on the slide here, the blood glucose level points to low. So low levels. So what to do? So when you have hypoglycemia, it is very important to drink half a glass of sweetened beverage, example juice, or to eat standby sweets with you, or glucose tablets, and to take them. So after you take them, you should feel better. Okay, if you don't feel better, you should actually test your blood sugar level again. And then if it's still not increasing fast enough, you should repeat what to do, which is to drink another half a glass of sweetened beverage, and then to eat more sweets. Okay. So that was a low blood sugar level. Now we move on to how to manage hyperglycemia, which is high blood sugar level. So some of the symptoms of hyperglycemia are feeling tired and weak. Same thing, same as the low blood sugar level, you will feel tired and weak.
and then so this is something to look out for. You will feel nausea, and then you also feel like vomiting. So this is signs of hyperglycemia. Then you will feel thirsty all the time. Then you have signs of, you will have frequent urination. So you'll feel like the urge to go to the toilet more often. Then you start to develop blurred vision. So all these are signs of hyperglycemia, which means that the body is in a state of high blood sugar level. Then it's too high for your body will start to get dehydrated. Okay, so then you need to have the following action to take to counter the hyperglycemia. So important, you first have to see a doctor to review and then get the appropriate medication to take so that you can bring down your blood sugar level. Then you need to have take the medication or insulin as prescribed. So there can be oral medication and then insulin usually in the form of injection. And then you have to learn to eat regular meals. So regular meals can prevent blood sugar spikes that is too high or too low. Then have enough sleep, drink plenty of plain water. So plain water is encouraged as opposed to sugared drinks. And then to take the habit, make the habit to check your blood sugar level more frequently. So every day you should at least check your blood sugar level before your meals, and then after that, after meals could be about 2 hours after. So you should check your blood sugar level and then see the trend. So we aim to keep the blood sugar level within control. Okay, so now important question. You know, for people that passed out already, right, like fainted and then not able to eat or drink, right? So if this happens in the home setting, you don't feed food to an unconscious patient or feed drink to an unconscious patient. So straight away call 995, call the ambulance and seek medical help. Then they will bring the unconscious patient. They will give the appropriate action now to them, like say fluid administered through the vein and all to increase the blood sugar level. Okay, so next discussion question we have, does poorly controlled diabetes lead to food complication? True or false?
True.
True?
Yeah.
Yeah, is it the general agreement that is true? Yeah, so diabetes food care. Okay, so moving on, we've covered the diet and we've also covered the medication. Now we cover the food care for patients with diabetes. So patients with diabetes, right, they have two kinds of main condition, which is neuropathy. So this happens because the nerve is damaged due to the usually the sugar level, abnormal sugar level. So when the nerve is damaged, right, it can lead to certain food complication. So one of them, right, is calluses. So you can see here, calluses is like the thickened part of the skin, but it does not mean that everybody that have callus have diabetes. People that walk a lot and, you know, when a lot of walking and all can also cause calluses. But more importantly, we want to look at the next one, which is people with neuropathy actually have symptoms, have ulcers. So ulcers are like open sores and wound, and usually these wounds are non-healing. So they will be there for a very long time. So it won't just like come and go. You will stay for quite a while. Yeah. So this is because the abnormal blood sugar level can also cause circulation to be compromised in the body, and then this may result in the development of diabetic foot ulcers, diabetic foot infections, or deformity of the foot. So on the right side here, you can see vasculopathy, which is damage to blood circulation and poor blood circulation. Over time, in the long run, once the blood supply is cut to usually the extremities of the human body, so usually the fingers and toes first, then you'll see gangrene will set in. Then when the blood supply is cut off, your toes and what will turn black. Usually this will result in you having to undergo surgery to amputate, which is to remove the affected part. Yeah, so if the amputation is not done, it's done already and then it still gets worse, then you have to amputate more. So you will start from toes, then to the foot, then it can go up to the knee and then above the thigh area. Yeah. So we would like to share with you on some simple diabetes food care that you can follow on a day-to-day basis to monitor and check your feet for any symptoms. So you can check your feet every day. Can do it once a day in the night, or you can do it in the morning. Yeah, so you can check the feet every day, especially the following areas, which is the foot, the sole, and then you check your heels. Check the heels for any cracks, because usually when you have crack, then bacteria and all can go in and easy to get infection. You also check in between your toes. So in order to prevent cracks, right, it is important that you adopt the habit to moisturize your feet daily, so that when you moisturize, it is smooth and supple, it doesn't crack. And dry skin cracks, right, then the bacteria can get into the foot. However, we do not advise you to moisturize between your toes, because when you moisturize between your toes, and then if it's the thing live there, right, and then it's how you say, it also can attract moisture, and then also as good source for bacterial growth. So we also advise you to trim your toenails weekly, and then to use a nail file to smooth the edges, and make sure that we trim it in straight across. We don't cut it in a rounded or like jagged manner, because then it also allows for bacteria and all to get, or dirt to get stuck underneath. Then yes, the last one is to wash your feet daily with mild soap and warm water, and very important to dry them well, especially in between the toes, because in between the toes, when you leave it wet, right, it's a good source of moisture, and then also a growth for bacteria. Yeah. So yeah, so these are some of the things. When we wear socks, we try to wear socks that are not too tight, okay, that limit circulation. And if it's too tight, also your feet will start to sweat, then that's not so good. Then we try to wear covered shoes that fit well and protect the feet. So the upper picture on the right side is to wear this kind of shoe that is covered. And then for the bottom shoes that are like sandals and heels and slippers, we try to avoid them for shoes that cramp the feet or have too much exposed surface area to the flooring. Yeah. So diabetes foot care, right? Usually this is the part where we have this special healthcare professional called the podiatrist. The podiatrist actually helps to manage the conditions of the feet quite a bit, and then they will help to also look into patients with diabetes and how to treat their foot care problems. So for the podiatrist can help to treat crack or fissuring skins, as can be seen on the heel, and then foot ulcers, foot wounds, example ulcers, calluses and corns. And then for abnormal toenails, sometimes, you know, when our toenails are too thick and have not been cut for a long period of time, it turns slightly yellowish and it gets very hard. So using a normal nail clipper, right, might not be able to cut through. So the podiatrist actually has special tools and equipment to cut it for you. And they also make sure that they don't cut too deep or too in, that can actually expose the inner portion to external dirt. So other foot-related conditions that they actually treat are also like heel arch, bunions. Bunions are actually, you know, when those people who have their toes a bit inwards here, so there's bunions here, the feet area, the big toe, and then the feet here, there's bunion. So the podiatrist can also treat such conditions. Yeah. So foot screening. Foot screening is very important. So yes, Josephine, do you have a question?
Yes, like we are treated by the polyclinic. Then where do we get the podiatrist? From the polyclinic or from outside? Where can you get the podiatrist?
Usually this one is the polyclinic you see and inform the doctors, then you have a podiatry referral. So you will make an appointment with the podiatrist to see them, and then they can perform the procedure on spot for you. They will assess the feet, then they will help you. So it's usually through referral. So the main source, the first stop will still be polyclinic, then doctor will assess and then they will refer accordingly to the podiatrist.
So this is still under the polyclinic treatment. Well,
yes.
This is not under private.
I mean, private also should have, but polyclinic will be
private. But private is very expensive, is it?
Yes, Josephine. In fact, for private podiatrists, you do not have to go through any subsidized polyclinic. You just have to pay upfront. But technically for diabetes foot care, when you go for a diabetes screening, it is most residents or patients who have diabetes will have to go through diabetes foot care, which will be assessed by the diabetic nurse, who's also tapped in polyclinic, for example. So these nurses will actually watch your feet. They have to check on your feet also. If there is a need, then they will refer to podiatrists. Yep.
Okay. Okay. Thank you.
No problem.
Okay, so food screening, your care provider will need to check for the following. They will check for blood circulation to the feet. So how they check for this, right, is that they will press your feet, and then after they will release, they will see how fast the toenails and all the blood circulation is good. Okay, they will check for pulses at your feet to see how strong is the pulse, which will also indicate the strength of the how good your circulation is. So if your circulation is very slow, right, then this is a cause of concern, because as mentioned earlier, can lead to gangrene. Yeah, so signs of neuropathy. Okay, so they will also check, right, for skin damage such as ulcers, any deformities of your foot, and then also nerve sensitivity. So this one, that's why foot screening is very important, because when we go to the for foot screening, the healthcare professional have this equipment that they also will use to test for the nerve sensitivity, such as they will test whether you can feel it, or and then there's a pressure and vibration. So if there is no sensitivity, let's say they stroke your feet and then you say, no, I can't feel. So it could be a sign of nerve damage. Yeah. Then calluses and all, if it's a cause of concern or it's quite bad, the condition, like Sister Mani mentioned earlier, they will actually refer you to podiatrists, and then the podiatrist can help you. So what the podiatrist can do is, if let's say there's calluses that is very bad, they will clean up the area, then they will cut off the excess dead skin and all, then they will let it heal they will wrap it up and let it heal. Yeah, then they will assess it over time. So another screening besides foot screening for diabetes patients is eye screening. So eye screening should be conducted to check for signs of retinopathy. So this is again another area where there's damage to blood vessels in the eye. And then this is usually involve eye examination, where the photographs of the retina is taken, and then to see if there's any abnormalities. So last but not least, we would like to cover the following, which is the principles of exercise. Yeah, so remember to exercise safely and take it slow, especially if you're just starting out, okay? Especially if you're just starting out and then you suddenly decide that you want to do very vigorous exercise, your body might not cope with it, and then you can also feel giddy and unwell, because vigorous exercise actually cause stress to your body, and then your blood sugar level can also drop very fast suddenly. So how to get started slowly and steadily with exercise? First, you can know yourself. Choose an exercise that suits your fitness level. For example, if you're someone who doesn't who leads a more sedentary lifestyle, or you work and then you don't really move around, you can start by having brisk walk every evening. So first, then you slowly increase to maybe more cardio exercise. So be patient and don't take on more than you can handle, because you don't want to cause unnecessary stress to your body. Okay, then you can also start gradual, example like 10 minutes of swimming, then 15 minutes of brisk walk. Then you increase the timing. Then you can also talk to your doctor before you start any exercise regime, so that and also the physiotherapist can advise you for certain strength-based exercise and cardio exercise. Always remember that when you exercise, for people with diabetes, you should bring along emergency sugar. So this can be in terms of like a bottled sugar drink, fruit juice, or sweets. So this is because if you start to feel giddy or unwell when you exercise, it will be necessary for you to take this emergency sugar to help to bring up the sugar level. Yeah. So the three main types of exercise are aerobic exercise, which is like cardiovascular. So you can do Zumba, swimming, all these, it helps. Yeah. Yeah, so anybody have any questions for exercise that you would like to ask us? Any question? If not, then maybe I share one important tip with you. So before you exercise, right, you can time your exercise. If it's just exercise right before your next meal, right, you can take a small snack before that, or half to 1 hour before you exercise. Then when you exercise, you will not feel so it will not like sudden drop in sugar level when you exercise lah. So if you are on insulin, you also need to be more careful when you exercise, as too vigorous exercise can drop your sugar, can cause your sugar level to decrease quite a bit. So again, always consult the doctor to understand further on how you can start your exercise regime. Yeah. So yeah, is there any other question? Because we have come to the end of our diabetes talk on how to manage your diabetes through diet, through medication, through regular appointments such as eye and food screening, and then also through exercise. Yeah.
Okay, I have one question.
Yes.
Usually, we have a habit of like after meal, we have dessert, so-called like something sweet, a piece of cake or cookies. Is it a good habit?
Okay. So may I know that am I speaking to Florence?
Yes.
Hi, Florence. Thanks for sharing. In fact, desserts, I would say no one would want to say no to desserts. As for diabetes, people
No,
who
no.
have diabetes,
I don't. I'm not a diabetic, but I just want to ask so that if it is a bad habit, then we should stop it.
okay.
I'm asking a general question.
Okay, in general. Okay, so in general, taking desserts, it's no harm if you're taking it in a way whereby it's in moderation. You have to take into consideration low sugar, not high in, not super sugary with too many creams on top of it. Then, in fact, healthy desserts. We look into healthy desserts. Then, of course, you are free to take it. Yeah.
So okay lah, it's okay to take sweet because the understanding also called not sure whether is it the mirth that when after food now your stomach is still digesting, so any sugar or any sweet things that is then it will digest together, so it will not harm your body. That kind of logic. Is it true or not?
Okay, so as long as you're taking a healthy dessert, you can make in variety. For example, it has been said that taking fruits before meal. So probably taking fruits before meal, half an hour before meal, it helps. And then where else you're talking about dessert, right? Take desserts that is not high in sugar content, such as for example, less sugar banana.
A piece of cookies, a piece of cake. Cake is usually sweet, but of course we can choose the not very sweet type lah.
Yeah, so as long as you take it in moderation, I think
okay.
The key thing is take things in moderation. Do not overdo it or do not overfeed yourself with all these desserts.
What about a cup of tea? Milk tea?
Pardon?
Because sometimes, especially when you eat outside, when you eat out, usually the food is with MSG. So you feel immediately you feel your mouth like very funny, the kind of you feel like you quickly you feel the MSG already. So a cup of milk tea helps. This is how I feel because I seldom eat outside food. Okay. But somehow like Sunday, after church lunchtime, so lazy to go home and cook. So you eat out. Yeah, you immediately feel it. Then I will quickly order a cup of tea, and that really helps in a way. But is it a good habit?
Technically, it's a habit can be prevented. So why not, rather than get yourself a cup of tea, try plain water instead. It will help you much more better because MSG and plain water will cover it off. So in fact, your thirst quench yourself by taking plain water. Try plain water. instead.
Water, drink, or definitely drink. Definitely there's water, but it's just that it doesn't really quench it. Only the cup of milk tea, I'm not sure whether it's a reaction on the milk. Then, or psychologically, you feel better after drinking the, but of course, should not be much because I may cause indigestion, right?
Yeah, so in fact, right after a meal, it is best to definitely take with plain water.
Oh,
Yes. Sometimes when we are out with a friend, random visiting or a random meetup, you tend to feel like wanting to drink such sweet drinks. The rule of thumb is take it less sugar or even no sugar. That
can have, but less sugar. But
Yeah.
I mean, most people, they like to have a cup of some young ones especially cold drink, which I don't. Immediately after food, worse. Cold drink is actually no good. So somehow, so it's not advisable to drink.
Yeah, it is okay. It is advisable to start slow. For example,
Half an hour later can
no, what I meant would be it would be probably start slow. In fact, from now onwards, maybe you want to order it to less sugar. Then maybe you put yourself in the next 2 months. Probably the next time I order with no sugar. Always take one step at a time to make yourself better. We are into preventive rather than we stop everything clearly. Yeah, so you can always make yourself feel happy by doing such little steps like that.
Sorry. It means tea is not advisable. So plain water is better. But if you order tea less sugar, meaning teh-o, you mean? Because milk tea has got no sugar. It's just the condensed milk.
Yeah. So condensed milk has sugar. Yeah.
Or
Condensed.
siew-dai.
Yeah. So you ask for less sweet. You start off with less sweet.
Ask for less sweet.
Yeah.
Or kosong.
You can try kosong at the end of the maybe.
Kosong,
Kosong.
Kosong no. Unless you have teh, then you can have kosong. But because teh definitely cannot be kosong. That means kosong is teh already. No milk.
So it's always best to start slower. Maybe if let's say cannot kosong, maybe try a little bit less sweet. Try lah, Florence. Try yo.
Thank you. So plain water is still the best.
Yes, plain water.
Zero calorie. Yeah. Okay, so we have a question. Is it true that diabetes patients tend to be overweight, and does obesity actually people who are overweight tends to lead to diabetes? So on this question, right? Okay, so to address the first one, right? How does obesity, right, as a condition, actually lead to diabetes? So what happens is that when you are overweight and then you are obese, so this actually means you tend to eat more lah. So you tend to have develop diabetes because when you eat a lot, right, then you have too much glucose or sugar level in your body. So when you have too much glucose or sugar level in your body that is circulating in your bloodstream, okay, the pancreas can only secrete a certain amount of insulin. So when it's too much glucose in your body, then this glucose, right, will actually turn into fats. Then these fats will be stored in your body in the adipose tissue and all. Then that's how you kind of get obesity. Yeah.
So we answered that question for.
Yeah. So that's the question we answer. And then do diabetic patients tend to be overweight? Also yes, because the opposite is also true. Diabetic patient also cannot have too much not enough the insulin, and then if it's not well regulated, again this excess insulin that is floating around your body will get converted to fats, and then they will get stored in your body. Yeah. So people with diabetes, right, why some of them lose a lot of weight? I think one possible reason we can look into it is because they have insufficient insulin. Okay, so this is also true. Too much you cannot convert and then store as fats in the body. Okay, then when you have insufficient, too little insulin, but then you're not eating enough, right? Then your body will start to use your own fats or whatever to break down, and then this can actually cause you to become thinner. So that's why some people with diabetes, they actually lose a lot of weight. Yeah, so important that people with diabetes to not totally cut down on eating, but they need to eat regular meals and eat balanced diet using the healthy plate concept, you know, then they can maintain a healthy weight. Yeah. No problem. Thank you. Any other questions?
May I ask you, after meal, I always feel like eating something sweet. I know it's not so healthy, but how about take dates, dry fit, yes, and something like this. Is it okay?
Sorry, you're saying you take dry dates, is it?
Is it? I wonder, is it my blood sugar lower than normal? So I have this urge. Really, I wonder how come always have this urge to take something sweet.
Okay. Can we just check with you first? What do you usually eat for your meal?
I don't cook. I always eat. Buy the from hawker center, or coffee shop. Like rice. Usually 3 items like meat, chicken, fish, and tauhu, vegetable, things like that. These days, maybe because of aging, I eat less. I buy one package, I can take for 2 meals because I left a lot. So I take for another meal.
So you actually get your meals at the hawker, right? So so if you were to buy food from hawker, you can actually see at the front of the hawker shop, they normally put their healthier choice, or probably they are into the healthier SG HPB logo. Those hawkers, they actually tend to serve food which are less salt, no MSG. It would be good to start on buying your meal from that kind of shop. And then like what you said, starting on with dates, and I mean avoiding sugary diet is definitely an important part. So you can replace your dessert into fruits. Dates are okay, prunes are fine. As so long as you ensure that it is being taken in moderation.
Oh, good. So I still can take it. Thank you very much.
No problem, Christina.
Yeah, thank you.
Yeah. So the question just now, Yuki daughter asked to repeat regarding the loss in weight, right? So I typed the answer there. So in people with diabetes, right, insufficient insulin will prevent the glucose, right, from the blood to be used and generated for energy. So we know we still need to go on with day-to-day activities. Then how we do our things is we actually need to have the energy. So the food we eat gives us energy. But let's say if you're not eating enough food and then you don't have enough of this energy, your body actually starts to break down the fats, okay, fats and muscle for energy instead. So if you're not eating a regular and balanced diet, then overall there's a loss in body weight. Yeah.
Sorry about that. Probably can you share it to everyone? Share it to everyone instead.
Oh, okay.
So Alicia will put up Alicia is putting up the answers for the questions asked.
Yeah, I don't know how to share to everyone.
And then as for Ms. Lee Si Tiang for webinar, you may check it out from the link that Felicia has given you. It's at now we are at 3:10 p.m. Any more burning questions from the audience?
Thank you, Sister Munia, Alicia, for the comprehensive sharing today. I think I learned quite a new bit from today's health talk as well. So while you all have any other questions, you may type in the group chat first. So like what Sister Muni has shared in view of time, it's about 3:10 right now. We will get Radima's side to actually share the passion card slides for you to actually top up your points and collect your points. So while doing that, you can think if you have any other questions, then you can feel free to on your mic as well to share with us. Madam Tan haven't bye-bye yet.
I thank you for the talk.
Yeah, team. Sorry, sorry.
Thank you. But by the way, in the morning, just the first cup of tea, have 1 teaspoon of condensed milk. That is healthy, right? And after that, no more already. So is it okay?
Yeah,
What's
we can start with 1 teaspoon. Then we cut down to 1 teaspoon because condensed milk is sweet, right? It actually have a lot of the sugar inside also So that's why we try to cut. But then of course we don't want to have no pleasure in life. So 1 teaspoon you limit to a day. Okay, a teaspoon not so thick also, just a thin spread should be okay. Yeah.
Okay.
Then you also monitor all your other food intake lah. So if let's say you take this one tea with the condensed milk, then maybe you don't take fruit juice, all those things. You can just take fruits in the.
Other than that, plain water.
Very good.
First cup, this tea, but I don't drink coffee.
Yeah, kickstart your day.
Yeah. 1 teaspoon. The sweeten that strong tea lah, but my tea is strong. Then I have milk. Thank you anyway, good. I missed out the front part. I joined in 15 minutes later. I thought it's 2:30. Until I checked, oh dear, it's 2 p.m. So
we had some technical issues, Florence. It's okay, you have missed up, not that much.
Oh,
yeah, we apologize for the technical issue and the technical glitch. We hopefully the next time round we can avoid that.
Oh, okay, thank you. So okay lah, I didn't really miss much.
Yes.
But when I started, it was just I think it was like talking about. I saw the what they call notes on maybe I missed first 2 pages. I don't know.
No worries, Florence. If you miss out the session, right, you can always go to Radima Silver Creek Facebook Live, Facebook page to actually relook at our recording session as well. So
not
we do
immediately one.
No, actually I think once you start, it will be uploaded to their Facebook page already because it's ready
Oh,
right now.
is
Right now it's already a Facebook Live itself.
Oh, thank you. Okay, good. Thank you.
We have one more question, which is, should we eat fruits before our meals? Actually, right, we advise you to eat fruits, but you can choose to eat it before your meal or after your meal. Just let's say if you eat before your meal, then you will kind of know how much more you can eat for your food. But if you eat after your meal, try to not eat too full so that you have some space for your fruits. And then some of you also ask us whether you all have this craving for something sweet to end your meal in a good note, like you feel good that you eat something sweet at the end. You can consider fruits. Yeah, fruits can actually is a very natural source of sugar that can help you to feel more satiated and happy after you eat. Yeah, so you can consider to eat it. Your choice.
Immediately, not half an hour later or before.
You can choose to eat before or after, but just have to limit your food accordingly. So, but then if you eat before your meal, then kind of like when you eat your actual meal, you will know how much more you can eat. But if you choose to eat it after your meal, then remember your main meal don't eat too full. Eat to like maybe 50 to 75%, because if you eat too full, then you eat the fruits down, it might be too much. And then fruits itself also considered a natural source of sugar. So it can also increase sugar level lah. So we have to eat in moderation.
So I mean, no need to wait half an hour or before, after, no need, immediately can. Immediately after food or before?
I think the purpose why people advise to eat half an hour before is like it allows your body to accept that you have some food in your body, regulate. Then it's like if you eat too fast, your body cannot register. Yeah.
So no harm lah, actually.
Yeah.
Thank you.
Welcome.
Okay, thank you, Alicia. I think we will take in one last question from Tiam. I read that if we eat fruits after meal, the fruits will rot in the stomach and it's very bad. Is this true?
We don't say if it is true or if it is actually a myth. technically we still have to actually check this out whether the food can really rot in the stomach or not. Technically, once food is being digested into your stomach, it won't.
It goes down directly as the same way as how you eat other food.
That's right, Alicia. Correct. So in terms of getting it rot in your stomach, it will then after that digested and come out as a feces lah.
It will be quite scary if it's if it rot in our stomach in such way, unless we are eating bad
But actually, it's an interesting question out there. Oh, we have one more by
excuse me,
Yuki Doctor.
Felisa. May I ask you, whenever I take any of the sweet things, can I take metformin or not?
So metformin, right? You have to.
Yeah.
Okay, so if we ask, your question is if you eat any sweet thing, can you take metformin before your sweet thing?
Yeah. Every time if I take anything like durian or ice cream, but not much lah, then I come back, I take metformin. Is it possible to take?
Okay, the also metformin, right, is has to be taken according to doctor's prescription. So metformin,
they tell me 3 meals one time only, but whenever after food then he advised me to take metformin.
Yeah, your
then
metformin.
Sometimes I go outside eat sweet thing, then I can take one more time.
No, the metformin should be taken according to prescription. So if let's say you take some sweet thing, right, we can suggest that you take it closer to your meal time. So together with your meal time, then after you eat your food, then you eat your metformin. But metformin cannot be taken overdose, can cause you to have very low sugar level. Then after that, you have effect of hypoglycemia. Then you will feel giddy, unwell, want to faint. Yeah, so the metformin, eat according to level. According to what doctor prescribed.
But metformin also not bad. Like whenever you take, I take, got pass motion.
Wow.
Very good at the metformin.
Metformin also, we encourage you to eat according to prescribed dose lah.
Yeah. Can pass motion easily lah.
Can I ask a question?
Yes, Julie.
I noticed that you record this Zoom, right? So can we go back to the recorded version again to watch? And where should we go? Facebook or what?
Actually, yes, definitely you can. So if you do have a Facebook account, you can actually go to the Silver Click Facebook page.
Silver.
Actually, Silver Click, the Radima Silver Click. Maybe I will get Yan Ting to actually share the link inside this chat box as well. So if you are very familiar with Facebook, if you just search Silver Click Radimas, then that's the page where the account, I would say, then you can actually see. You can actually see the pre-recorded sessions, the recorded sessions that we have today, or actually all the other previous sessions that we have with Radimas, and they also have other pre-recorded activities that has been on there as well.
Yeah. So if I just click Radimas, should I be able to get it? Instead of silver,
yes,
silver page or silver what? I didn't hear.
Silver Click.
Click, CLICK.
Yes, correct.
Oh, okay. Thank you.
Because Radimas, they have two Facebook
pages.
You must check. You must find the correct one. The Silver Click is mainly for all these programs.
Okay, Silver Click. Thank you.
Hello, can I ask a general question? Hello.
Yes,
can I ask a general question? If let's say, immediately after eating durian, can take medication of any form, let's say BP medicine or whatever, or cholesterol, must you wait for 1 hour or 2 hours in at least interval before you can eat the medication? Durian is some form of fruits, right? Immediately after fruits, we can eat any medication. What about durian?
Okay, so eating medication has to be according to the.
I know it's immediately after a medication, but as the lady says, after you see when you eat outside, after that you eat some dessert, maybe the durian store is next door, you just eat some durian. Then after that we have to eat our medication. So can we, whatever medication, I don't mean it's not what she take for the diabetic, about any medication, can we eat immediately after urine. The prescription of the medicine is after meal.
Okay, so
对
it
不
is
起，我先退出啊，对不起哦。
拜拜，Madam Tan。
拜拜，时间过了。
back to me. Okay, so the prescription is actually okay. So the prescription for the medication is to be taken after meal.
Yes.
I'm trying to say that. Yeah. So hence, it is okay as long as you're eating the medications prescribed after meal.
Yeah, but what I mean is, can we eat immediately? Does urine interfere with the effect of any medication?
There is no general, I mean, there is no specific answer for durian hence itself. As that if there is no any clause for the medication to be taken with durian, if let's say the medication did suggest that do not take with durian, then you should probably avoid it.
Normally they don't state that, but
yeah, if there is no statement for that, then probably you can proceed on with taking it after meal.
Oh, okay, because you see durian, after you eat durian, you cannot, as far as I heard, don't know whether old wives' tales or what, you cannot drink liquor or what. So this I always associate with, you see, after medication, after durian can be medication. After, you see, after durian, normally people say cannot drink liquor or whatever. Is it true?
I think for liquor is they say there's some interaction, but then so far that durian, right, has not been proven to interact with any medication. One possible reason why, you know, if you take durian is considered a fruit, but it's also very high in sugar content. So if you take durian and then you take alcohol is also very high in sugar content. You can cause even for normal person, it can cause a spike in sugar level, can cause you to feel unwell, you know, and then you can feel like bloated, nausea, vomiting. This could be because durian on its own is considered a fruit with high sugar content. Therefore, it's encouraged not to eat too much of it for everybody, especially people with diabetes. Yeah, but so far, what we can share with you is that we have not heard about durian interacting with medication. But if you want to play safe, maybe you can rest for 15 to half an hour, then you take your medication.
Okay.
With sips of water, but don't take too much water because later you feel bloated.
Wait for 2 hours. Like they said normally to play safe is always wait for 2 hours before any reaction.
Normally those advice when they say to wait 2 hours is when you are actually taking Chinese herbs or TCM medications, then we will actually advise the individual to take 2 hours.
Thank you.
Okay, we hope that we have answered all your questions. I know there are some other questions along the way, but we try our best to actually answer all already. And I understand it's a bit running a bit later than our usual time. It's already about close to 3:30. So if you have more questions, perhaps you can join us for our next health talk, which is in the Mandarin version next Monday at 2 o'clock as well. Then perhaps you can actually help to answer a bit more. So if you would like to sign up and know about for our upcoming talks, actually share the link earlier on in the chat box where you can register yourself for upcoming talk. And also for those who want to know on how to view back the recorded page, the recorded videos, I mean, then you can actually, I also shared the Silver Click Facebook page. You can actually click in the website as well to actually take a look as well. So once again, thank you, Sister Mooney and Alicia, for the sharing and everyone's participation. So otherwise, we will see you all next Monday. Bye-bye.
Bye.
Bye-bye.
Bye. My one cannot hear. What's that?